Welcome, welcome. You are at the Medicare 101 for your business uh, webinar. I am so thrilled to welcome you all today. My name is Ashley Powdar. Fantastic. I see some people still trickling in. Wonderful. We're going to get started in just a moment. And before we do that, just a few housekeeping items. We ask that you please use the Q&A function specifically for any questions that you have. It helps us track all your questions easily. And if you have any resources you would like to share, please use the chat function for that. And feel free to introduce yourself. Tell us where you're dialing in from, your name, your organization, and also just another housekeeping item. This call is being recorded. We will share out the recording using the same link you used to register for this event. So no need to write anything down or feel like you need to remember it all today. We will share this out after the call. So welcome, welcome. And I am really thrilled to welcome my great colleague, Xavier Vaughn. He is the program manager of the Medicare Education Program at AARP. Xavier is an excellent baker. For anybody who knows him, I can personally attest to it. I have, he made me an excellent cake once. He is a passionate advocate and a passionate advocate for this work, this body of work for the Medicare education program. Xavier also has a strong strong background in Medicare education. So we're really thrilled to welcome him here today. Xavier, over to you.
Well, thank you very much for that, Ashley. And if you were wondering, I made her a caramel rum cake. And so we are going to get started today. You know, Medicare is something that's always going to impact us all at one point in time or another, whether for ourselves personally or for a loved one or for you in the business world, maybe for you assisting your employees who are about to age on to Medicare. So this is something that we all need to know, no matter kind of where we are at in our stages of life. So the agenda for today is we're going to go over some Medicare basics, going to educate you all on what your employees need to know, and give you some resources. So just in case, as Ashley said, this will be shared out, but you'll also have a list of resources that you can use and go back and get to your employees. Okay, so some of the common questions that we get, it kind of is, what is Medicare? What's the difference between Medicare and Medicaid? What is covered? What's not covered? When should I enroll into Medicare? What happens if I don't enroll? And how will Medicare work with my existing healthcare coverage? So your role as a business owner is to provide Medicare eligible employees with educational materials about Medicare, connect them with unbiased resources, and help them navigate help Medicare eligible employees navigate and avoid enrollment penalties. So what is Medicare? Medicare is a federal health insurance program for people aged 65 and up. If you are 65 and up and you're currently receiving Social Security, then you'll be automatically enrolled into Medicare. If you are 65 and you're still working, haven't started collecting your Social Security, and you decide to enroll into Medicare, then you actively have to do so through the Social Security Administration. If you are under the age of 65 and you're collecting your SSDI payment or receiving that disability payment, on that 25th month, you'll be automatically enrolled into Medicare. And then if you have end-stage renal disease or ALS, you are eligible for Medicare, but you do have to actively enroll into Medicare. So only people who are 65 and older and collecting Social Security and those who are on disability, those are the only two times that Medicare enrollment is automatic. All the other situations, a person has to actively enroll into Medicare. So your employer responsibility is going to be the same thing as what they're kind of responsible for right now, right? You have your monthly premiums, your deductible, your co-insurance, your co-payments. So that should not feel unfamiliar to them. So a lot of people are really shocked to hear that Medicare does not cover hearing, dental, and vision or long-term care. There are some times that you can get some vision stuff, like if you are a diabetic, there's some things that just because you're a diabetic, you can get some vision stuff, but it's not comprehensive or anything to that level of, or degree. And long-term care is not covered. So nursing homes, once a person reaches a certain age and they need to go to a nursing home, they're going to have a separate long-term care insurance. So the different parts of Medicare. So part A is going to be your hospital coverage. And this is going to be your inpatient hospital care, some hospice and home health care, and some skilled nursing facility care. And there typically is no premium for Part A. As we know, we all pay into Medicare tax, and that helps you to get a premium-free Part A. And it typically takes about 10 years in order to get that premium-free Part A. You can get 4 work credits every year. And with that being said, at the age of 30, I have had premium-free Part A. If I had to go on Medicare tomorrow, my premium would be free already. So I think probably by the age of 27, 28, I was already at that threshold. So it doesn't take a long time to get there. And where we would sometimes see that what happening would be at a stay-at-home spouse, right? That may not be able to work, or teachers actually didn't used to pay into Social Security or into Medicare. And so so if you have like an older teacher, you may have saw them work a little longer, but they could qualify for Medicare for that premium free Part A. But with that being said, you can draw off from a spouse, or if you had a child who is disabled, who is going on to Medicare due to a disability, they can also draw off from a parent's work credit history. So the deductible for this year is $1,676 for days 1 through 60 of inpatient care, and the deductible can be applied again for additional hospitalizations after 60 days. So for example, if you're in the hospital on January 1st, and then you get out a week later, but then for some reason you have to go back 30 days later, you will still be within that deductible period of 60. So you wouldn't have to pay that almost $1,700 again. Go in on January 1st, and now that we're at May 1st, you would have to pay that deductible all over again. So Part B is your medical insurance. And how I like to remember Part A goes to hospital and Part B goes to medical. If you put hospital and medical in alphabetical order, they coincide to their parts. So A for hospital, B for medical. So these are going to be your doctor's office. So when you go see your primary care doctor, this is what is going to be covered under Part B. Your outpatient hospital services, your durable medical equipment. This is going to be your wheelchairs, your hospital beds for your house, and Medicare approved preventive services. There's a full list of preventive services that are covered. You get a new to Medicare preventive service screening. You obviously have your yearly cancer screenings, obesity classes, smoking cessation classes, and the list kind of goes on and on. So the cost for this year is you have a standard premium of $185 per month to be in this. And so, but unfortunately, if you have an income of 106,000 or for a couple 212, you will have to pay a higher premium than that $185. But that being said, it is a sliding scale. So someone who makes 106,000 will not pay the same premium as someone who makes 400,000 a year. It is a sliding scale. And the annual deductible of $257 per year. And after that, you would have a co-pay or co-insurance of 20% for most services. So if it was your first doctor visit of the year, going to see your primary, you would have to pay that $257 deductible. And after that is met, any future visits, you would have to pay only 20% of whatever that approved Medicare cost would be. So Part C is also known as Medicare Advantage. This is what you really see all those commercials on TV about, where you see JJ from Good Times on the commercials. You know, This is what he's talking about. He's talking about these Medicare Advantage plans. And so these are an alternative to original Medicare. You know, in this day and age, we love a good bundle deal, right? You bundle your phone, internet, and cell phone all together. Um, this is what the Medicare Advantage plans do. They bundle your Part A, your Part B, and most of the time your Part D, which are your prescription drug coverage, into one comprehensive plan. And unlike with original Medicare, which is administered through the federal government, these plans are going to be through your private insurance companies. So your Aetna, United Healthcare, um, Humana, these are going to be administered through them. And this also may limit your ability to purchase a Medigap in the future. And so, unlike with original Medicare, which you have a free range to go to anywhere in the country that accepts Medicare, your Medicare Advantage plan are going to be your HMOs, your PPOs. So those you may not exactly know what those are, but you know when you sign up for insurance every year through your employer, you see those names, right? So with that, you're going to have to deal with in and out of network. You may have to pay an additional premium, so you're going to have to still pay the $185 that's associated with Part B. You may have to pay an additional premium for these costs, and you may have to follow insurance company rules to see a referral or something in the future. So Part D is prescription drug coverage. If you didn't know, Medicare got signed. We are in the 60th year of Medicare being into law. It got signed into law in 1965. I'm from Missouri, so I like to say the nice little fun fact that it got signed into law in Missouri. And Harry S. Truman, our only president from Missouri, and his wife were the first people to receive a Medicare card. With that being said, Medicare got signed into law in 1965. Part D became law in 2006. So you can see how long it took them to have the prescription drug coverage in this program. And so these, just like with Medicare Advantage plans, these are administered through private insurance companies, and they help cover the cost of your medications at the pharmacy. In 2005, the monthly premium can range from state to state, county to county, zip code by zip code, that there will be a monthly premium associated, co-pays and co-insurance, and there's an annual deductible up to $590. And people with higher incomes will pay a higher Part D premium. So this chart just is a nice little display of how you can navigate Medicare. If you want to do that original Medicare route, which is Part A and B. Part D is optional, but you'll soon find out that even though it's optional, it's something that you probably wouldn't want to enroll in. Or you can go with the Medicare Advantage or Part C, which combines A and B, and most of the time Part D into one comprehensive plan. So with original Medicare, you have a fee for service. It includes Part A and Part B. You can go anywhere in the country that accepts Medicare. Most providers are going to accept it. So this is something that if you are a snowbird, you spend part of the year in one state, part of the year in another state. This may be something that would be you would want to look into. You can choose and join a Medicare prescription drug plan for drug coverage. So Medigap plans, or they may hear it known as a supplemental insurance policy. These are also private insurance companies, and the name does exactly what it suggests. Helps fill in the gaps or supplement what original Medicare does not cover. And so, there are 8 standardized plans that are associated with Medigap coverage. And they are also associated with the A letter. So do not get Plan A and Part A confused. Part A are the different sections within Medicare, or the plans are only associated with Medigap plans. So if you hear Plan A, they help cover some deductible, co-insurance, and co-payments, and you cannot have a Medigap and a Advantage plan. It is really important to buy a policy within the first 6 months of enrolling in Part B, whether that be if you're new to Medicare or you delay your enrollment because you are still working. And the reason why it is so important to enroll into a Medigap plan, if that's what you would like to do when you're first eligible, is because there is no underwriting process. They will not look at your health history to determine if you can get into that plan. So say if you decide within the seventh month, so we're outside of the 6 month window, to get a plan, they're going to look at your health history. They still may accept you, but you may have to pay a higher premium. Now, some states are a little more flexible with this than others. For example, you in Missouri, if you were to enroll into a plan after your window of opportunity, you can enroll in that plan. In the following year, during your anniversary period, you can go to a different plan, and they won't look at your underwriting anymore. And so you may pay a higher premium that first year, then go back to a normal premium kind of the second year. But like I said, that differs from state to state. And whereas um, the governance over even Part D, MA plans, and original Medicare is at the federal level, even though some of them are administered through private insurance companies, these are kind of administered at the state level. And it's really important when you are kind of looking at the plans is to look at kind of the market share, so how many people are enrolled in those plans, and look at the complaint index to see how many people are complaining about those plans. Um, that way you can make sure that you are enrolled into the right plan for you. And it's really important to note that a G plan is a G plan is a G plan. So it doesn't matter what insurance company you go with, they all have to cover the same exact thing. And with that being said, they're going to, depending on the insurance company, is going to depend on how much you pay for that plan. So there's a lot of things you have to consider with a Medigap or supplemental plan. So Medicare and the Inflation Reduction Act, there were a lot of improvements made with the Inflation Reduction Act, which is something that ARP really advocated for to ensure that people who needed the more help and more assistance could benefit from it. And really some of these changes benefits everyone. So the first one we're going to talk about is insulin is now available at $35 per month. It's also really important to note that not every company has to cover every insulin. So it could be that the insulin that you're on is not within the formulary or covered by that Part D plan or Medicare Advantage plan. So the insulin that you're on may not be 35, but there will be a $35 option on every plan. Access to recommended adult vaccines without cost sharing. And so this would kind of expand it to have more range, make sure that adults are, as we get older, we become more susceptible and vulnerable to diseases. So this is really important that we have access to these vaccines without any cost sharing. And then we have the expansion of the low income subsidy program, or you may hear it also referred to LIS or extra help. And this is a program that is that the Social Security Administration oversees, and it helps those who are up to 150% of the federal poverty level to get help with their Part D co-pays and premiums. And so it will help lower the cost of their medication. The really big one I want to focus on is the yearly cap of $2,000, which was just implemented this year. I know so many people have heard about the donut hole, and people don't necessarily know what it is, but they just know they don't want to be in it. And who knew that something so sweet and delicious could be so terrible for a person who's on Medicare? But now we have a $2,000 cap with Medicare. So say if you have a high prescription that you take, say within 4 months that you're on it, it's cost $500 per month. So by the end of April, you'll reach that $2,000 cap, and you wouldn't have to pay any more money for your medications, which is wonderful. Not only that, you can now spread out that $2,000 over the course of the entire calendar year. So instead of having to pay that $2,000 all up front within the first 4 months, you can now spread that $2,000 out throughout the entire calendar year. And we know how beneficial that is for some people out there. So when do employees enroll in Medicare? So there's a few different situations when a person can enroll. They can enroll during their initial enrollment. They can enroll during a special enrollment, or they can enroll during the open enrollment or the general enrollment period. So your initial enrollment. If an employee is receiving Social Security, as I mentioned earlier, they're automatically enrolled, and they have a 7-month period of when they can enroll. They can enroll 3 months. They have 3 months prior to their birth month, their birth month, and 3 months after. The one caveat to that is if you're born on the first, then your birth month would be moved up. For example, my Uncle Charlie was born on June 1st, so his birth month is no longer June, it is actually May. So that moves up the entire process 1 month earlier. And if you do not sign up when you are first have the opportunity, and this does not include people who are still working or still covered, then you may have to pay a late enrollment penalty. You will have a higher Part B and Part D premium. And this is why I said, even though Part D is considered optional, if you do not sign up when you're first eligible, then you will have to pay a Part D penalty. And we'll go over the penalties a little bit later on, but these penalties will stick with you for a lifetime. So a special enrollment. For employees who do not enroll in Medicare when they're first eligible, they do have a special enrollment period. This is for people who are 65 and over and currently working and covered by their health care coverage, or if they just lose coverage at the end of their employment. And this is also true if you are getting your coverage through a spouse. You would also qualify for this special enrollment. And with that being said, it's not just if you lose coverage. It could be if you move, if you were to move into a nursing home, natural disaster. There's multiple special enrollment periods, not just this one. Open enrollment. So the annual open enrollment period is the same exact time every single year. It does not matter what day of the week it falls on. It will always be October 15th through December 7th. And this is when people can make changes to their current plan. So if a person is enrolled into a Part D plan, they can shop around and they can stay with that plan. They can go to a different Part D plan, or they can make the switch to Medicare Advantage. And just remember, if you're on original Medicare with a Medigap plan, and you decide to make the switch to a Medicare Advantage plan, you would have to drop that Medicare, the Medigap plan. And the true is the same in reverse, in the inverse. So if you're on a Medicare Advantage plan, you can shop around and go to a different Medicare Advantage plan, stay on that plan, or make the switch to original Medicare and pick up a Part D plan. And if you wanted to look into a Medigap plan, you could. That you can do that throughout the entire year. That Medigap is not beholden to this open enrollment period like Medicare Advantage and Part D are. So penalties. For Part A, you have this penalty will last for twice the number of years that you do not sign up. So say if you go 2 years without signing up, you would have that penalty for 4 years, and it's up to 4% increase for the monthly premium for monthly premium. Part B is in boy. For every 12-month period you do not sign up, you will have a 10% increase to your monthly premium. And the key there is 12 months, right? There's no rounding up. So if you're, don't go with that, if you go without it for 11 months, then this penalty will not be assessed to you. If you were to go 13 months without, then you would only have that 1 year, for 1 year or the first 12 months of a penalty. And this penalty will stick with you for as long as you have coverage. And remember, the Part B is $185. So you would have to pay nearly $20 on top of that $185. So you're going to put you over the $200 mark. So you can understand why it's important to sign up. Now, Part D, even though Part D is optional, like I said, this is why it's optional, but you should probably sign up for it. And also, you just never know what's going to happen. So you need that prescription drug coverage. For every month you go uncovered, you have to pay 1% of the natural base beneficiary premium. And for this year, it is $36.78. So a good example with this would be, and we'll talk about this program a little later on. There's this program called SHIP, the State Health Insurance Assistance Program, and that's how I got my start within Medicare. As I mentioned earlier, Part D became a law in 2006. I think this was probably 2018. I was helping someone with their Medicare, and from 2006 to 2018, they never signed up for a Part D plan. And for this one, like I said, is every month you go uncovered. So this older lady nearing 90 would have to pay 144% of the base premium, which was, I don't think it was $36, but it probably was 33 to $34. It remains the same, pretty consistent from year to year. So 144%, we'll just say of $36. The cheapest plan that we had in Missouri that year was $15. Her penalty was going to be over what the actual cost of a plan would be. And luckily, we got it resolved. But you can see where they can really add up and cost a person a lot of money. And we all know that for as we age, we should make sure that we remain financially secure just in case when things pop up. And so, like I said, all these Part B and Part D, they will stick with you for a lifetime. The one caveat, I guess there are two caveats to that, would be if you qualify for an assistance program, then it will be waived. Or if you are on Medicare due to a disability, if you once you turn 65, it's kind of like a clean slate. You can start fresh, and that penalty will go away. Medicare and your business. So there are some rules that are associated with Medicare enrollment and the size of your employer. So if you work at 20, if your employer and have less than 20 employees, then they must sign up for Medicare, and Medicare will become their primary insurance. If you work with the one caveat to that is if you are in a group health plan and one of those employers are more than 20, then you can follow the rules of the more than 20 employees. And so if you work with someone with more than 20 employees, then you have options. You can enroll into Medicare when a person is first eligible. You can kind of do a hybrid approach. So we know for most people, Part A is free, so they can enroll into Part A when they are first eligible and delay their Part B enrollment. Or they can enroll in both A and B at that time. It just really depends on what a person would want to do. And Medicare will become their secondary insurance to their work-based coverage. And so these are just kind of what I went through. So for a small employee, they must enroll in Part A and Part B unless they can fall underneath a large employer because they're in a group health plan. And then if you are in a large employer, you can enroll in both. You can enroll just in A, or you can delay enrollment in both. This is a initial enrollment education timeline. And so you'll get kind of overview letter and you're kind of like your welcome to Medicare information 6 months prior. And then remember, you can start that enrollment process 3 months before your birth month. Then you'll have your then you have your birth month. And then 2 months after your birth month, you have final communications. And then at the end of the 3rd month, your initial enrollment closes. So engaging your employees on Medicare, make sure you are clear and consistent, refer employees to trusted and reputable sources, and educate them on Medicare prior to eligibility. That's something that I'm in the process of doing right now. I work at AARP, of course, and I'm trying to set up this Medicare 101 presentation for us internally. That's something that we just don't do. And people come to me with me for all these questions and say, "Oh, I might as well just do the same presentation for them." So resources. And before we actually get into resources, I also want to kind of talk about some assistance programs that people may qualify for. We talked about extra help or low income subsidy, which is a program administered through the Social Security Administration, and they help with your Part D or your prescription drug coverage, help with the co-payment deductibles and the premiums there. And then you have a program called Medicare Savings Program. And these programs are administered through the state Medicaid office, but it is not Medicaid. So if you are enrolled into this program, then you're automatically enrolled into extra help. You receive all those benefits that I was just talking about. Then on top of that, you get assistance with your Part B deductible, co-pays, and premiums. And so that's a really big help. And then finally, you have Medicaid. which can differ from state to state on some of the qualification or eligibility requirements. There, you do get a $2,000 disregard, and your house and your car does not count towards when you look at your assets. And as we know, Medicare does not cover um, long-term care, but Medicaid does. And so that is where you can get some assistance with that as well. And there's also some things you can do to put things in trust and different things to help um, a person become eligible for these assistance programs or just to protect them as things move forward in life. So for assistance, one of the things that a person can do is they can go to Medicare.gov for assistance. And the really great thing is if you forget that 1-800 number, it is literally 1-800-Medicare. And so that is how you can kind of remember that. It is really important, I think, for a person to go on Medicare.gov and create an account. You can go on there and see some of your billing information. If a person were to lose their red, white, and blue Medicare card, then they can go in and request and download a new one. And this is also how you can shop around, right? You can go in. The really great thing is within the new system, all other medications should be auto-populated for them. We highly recommend though them looking to make sure that the dosage is correct and the frequency that they receive their medication is also correct. The medication will be pre-populated for them. They can select the pharmacy in their town that they want to go to, and then they can shop around for Medicare Advantage plans and Part D plans. You can sort it to see what the lowest cost would be there for you. And the lowest cost, when looking at the lowest cost, it will take into account the cost of the medication and the cost of the monthly premium. So it's a really great resource to have. And if you're computer savvy, to go through and go on your own. Other really great trusted resources are the Medicare Rights Center and the SHIP. The Medicare Rights Center is a nonprofit organization that puts out really great information and great resource. I know we partner with them here at ARP to answer some of our questions online and different things. And the other one is SHIP, or the State Health Insurance Assistance Program. This is a federal grant that is in every state and U.S. territory, and they provide free and unbiased Medicare counseling. And so they're not affiliated with their insurance company. And they'll make sure that they will look at all the options that are available to you. And they will also screen you for all those assistance programs that we just went through. And with the SHIP, there is also, they can also get you enrolled into just original Medicare, your Part A and Part B online through the Social Security Administration. They're out there in the public doing presentations for people. If you ever would want to become a volunteer, I know they're always looking for more volunteers out there. So some ARP resources. This is our landing page. It just got a facelift about a month ago, and we're about to go through another facelift soon. So if you go on there, maybe in July, it will look slightly different, but don't worry, you are at the right place. This is our landing page where you can kind of get all the latest and greatest. Not only will you get great articles that will teach you more about, go into further depth than I did during this presentation about Medicare, you can also see what ARP is doing around Medicare advocacy work and ensuring that Medicare remains the program that it is today and only can go up and improve. Okay, our next resource is the ARP Navigator, Medicare Initial Enrollment. And I will say this is only available to people if they are an ARP member. But this brand new program that we are offering is super unique and one of a kind. And what it does is a person will log in, enroll into the program, and they will answer a few questions. Then they will get a self-designed course made specifically for them on where they're at in their Medicare initial enrollment journey. And so the information that they see will only be pertinent to them if that is where they're at in their Medicare journey. You may say, well, it may change as I'm going on it. If it does change, don't worry. You can go back and repopulate, re-answer your questions, and the course will repopulate for a with the course where you're at right then in your journey. And the really great thing is this is the first course of its kind for us at ARP. Launching hopefully this month will be our second course, which is ARP Navigator, making the most of Medicare. And that course is designed for people who are already on Medicare, where they can understand truly what kind of benefits they have and how can they can get the most of their benefits and maximize their coverage. And then closer to the fall, we will be launching our third Medicare course, which is ARP Navigator, Medicare Open Enrollment, to guide people as they may make changes and updates to their Medicare plans for the upcoming year. And the really great thing is, obviously, this is the Medicare 101 course, and I've been talking on about Medicare, but we will also be launching this year in other issue areas, such as financial security and working jobs. And I think the plan is for at the end of this year, maybe early next year, to get into a caregiving course. So we're really excited about this new framework and really meeting people where they're at and getting them and designing a program for them where they're at in their journey. Because we know so often in life where we're at, there's a journey and we just need that information that we need and nothing else. And the next thing is our Employer Resource Center. And you can get a lot of information here, not only on Medicare and different things. So in order to get to the, I do not know why, but this always does this on this slide. It will jump to the conclusion real quick. And so you would just type in Medicare in the little search section, and you will get all of our toolkits that are available to you for your employees. So I just want to say thank you. And right now we're going to have a quick poll that will be popping up on your screen. Don't worry, it's painless. Just a few questions on this presentation that we had today. In conclusion, though, we know that Medicare can be quite complicated and quite complex. And it's something that we can all relate to, something that we're all going to face at one point in time or another in our lives. Just remember that ARP is here to help you navigate this complex world that's Medicare. And we will not only will we be here to help guide you, we'll also be here to help guide your employees and give them resources that are available to them.
Thank you so much, Xavier. And as we launch the poll, you should see it on your screen momentarily. We are going to use some time to open the floor for questions from the audience. Xavier gave us a lot of information to digest, so we're going to give it a minute. And as a reminder, you can drop your questions in the chat in the Q&A function. And as we're waiting on questions to roll in, I'm gonna start with one. Xavier, thanks so much for just excellent resources shared. Curious what happens if I miss the deadline as a small business or small employer, what my options are?
Yeah, so if a person were to miss their initial enrollment period, or they are retiring and they're losing coverage and they miss their special enrollment period, there is a period called the general enrollment period, which is January 1st through March 31st. That was me thinking if March has 31 days or not in that month. But during that time, a person can enroll into Part A and Part B, and the coverage would begin the first of the following month. And if it hasn't been 12 months, then they will not have to pay a penalty for Part B, but they would have to pay most likely a penalty for Part D. And so hopefully it would just be a few months, so it wouldn't be too many months of that 1% of the natural base premium cost, but it could be there.
Amazing. Thank you so much. And we have some questions coming in. So I am just gonna, I see one from Catherine Herber. So why do employees have to stop HSA contributions 6 months ahead of time?
So I could not answer why. I just know that is the rule for them to do so. And Medicare as a whole just doesn't have HSA accounts. There's not a plan that has those. So I think it's probably just associated with there's not the high deductible plans that are kind of associated with HSAs, like within the employer, like within Medicare. So I just think it just isn't an apple to apple jump over. But with that being said, they can still use that money. They have to stop contributing, but they can continue to use the money afterwards.
Amazing. Thank you so much, Xavier. I am now seeing the poll on my end. If you guys are able to see it, we're going to leave this up, give you a minute. We'd like to leave it up for at least 1 minute to give you a chance to please take our live poll. You should see 3 questions on the screen. We are going to continue moving forward with the Q&A as we give folks a minute to respond to the live poll. We have another question for you, Xavier. Do you suggest people to sign up for Part A, B, C, D when they're eligible 3 months before their 65th birthday? Are there any disadvantages of signing up for all parts when eligible?
So I think it just really depends on what a person wants. But just remember, you wouldn't have to sign up for A, B, C, and D. Most likely, can remember Part C or Medicare Advantage plan kind of bundles A, B, and D together into one comprehensive plan. But if a person is still working, if they want to be double covered, they can enroll into all those plans. But with that being said, they are covered under their employer or their spouse's employer for that coverage. So it would be an additional cost of at least around $200 more if they were wanting to be in both the employer and Medicare plan. And with that being said, if a person wants to enroll into Part A, since for most people it's free, that's what we see a lot of people do. They stay with their employer sponsor, but they do enroll in Part A since it's free. And then once they retire and lose that coverage, then they enroll into the Part B as in boy, and then go either the original Medicare route and pick up a Part D plan or the Medicare Advantage route.
Excellent. Thank you, Xavier. We have Catherine has a follow-up question to her other question about HSA contributions. And this one's kind of a 2-parter, so bear with me. She wants to know what she should do if her employees don't know 6 months before that they're gonna be on Medicare. And she's asking specifically, what if they don't know 6 months ahead of time that they are going to sign up for Medicare so they can stop HSA contributions?
I think that is something that within your human resources and benefits department that you just need to make sure that your employees are kind of aware of these things that are happening. And so even if they don't know if they're going to retire, that's something that they can start thinking about, saying, oh, I might be 64, I'm nearing Medicare age. This is what I need to know. And I think it's something that maybe in your yearly benefits package, when you look at when people sign up, include in some of that information as well. So I think it's kind of on you as an employer to make sure that your employees are kind of well informed in that type of way. I mean, we can do all I can do right now. We do have on the employee resource page that we shared in the presentation, there is one that is on HSA. So feel free to use that and include that in your information that you send out to some of your employees.
Thank you, Xavier. And we're getting some questions about sharing out the recording and the slides. Yes, we will share the deck that Xavier has been gracious enough to walk us through, and we will also share the recording using the link that you used to register on the call. So we have another question from Kathleen. Kathleen wants to know if you have insurance through your employer and you sign up for Part A, when you become eligible, are you subject to penalties on Part B and D when you retire?
No, because at that time you would qualify for a special enrollment period. I should say no, but we also know that, remember, if you fall underneath the small employer category, then you would have to sign up for Medicare when you're first eligible.
Excellent. Thank you so much. And another question that we have is that, there's a lot of information floating around right now. It's hard to know where the trusted and verified sources are. Xavier, do you have any further thoughts or tips, resources to share on, as a small business owner, where you can find some unbiased information on this topic?
Yeah, honestly, I'm going to mention AARP, right? We're going to have a full list um, of resources, go on that Medicare landing page. You're going to find articles. If you go on the employer referral page, there's different things. And what I will also make sure is included is we have a new infographics landing page that is really beneficial, that you can use and send to your employees. And so we're going to be a trusted resource. The shifts, as I mentioned earlier, they're going to be another really great resource for you to go to use. They also they will come to your employee if you have like a big conference room and want to do something in person. Some of them will come in person to do that for you. And then also Medicare.gov is also a trusted resource in getting information. And so there are a lot of things out there. It's just a matter of ensuring that it's up-to-date information, because sometimes information can become outdated very quickly in this landscape. Medicare changes happen every single year, right? I'm working on a project right now for work, and some of our information, it just still has a 24 date, so to make sure that we get everything up to date. Medicare Rights Center, which is included in here, they also have really great information on their website. And so I think if you use the resources that are listed within here, you cannot go wrong.
Did I hear you correctly in saying that AARP can offer some type of information session or training to employers?
Yes, that's something that I can do. Yeah,
Well, you heard it.
Yeah, so if you
Yes.
want something for your employees, I am more than willing to do that as well.
And I think that's that's a resource a lot of small businesses and employers don't realize they have at their disposal, which is often, a free and available resource to use. So I'm thankful to you, Xavier, for highlighting that. And so we have a few more minutes before we close. We might have time for another audience question. And before we close, Xavier, one final question on our end. Is there any final thoughts you want to share? Any mistakes you see that are commonly made from the small business and employer side around Medicare enrollment?
Yeah, I think just make sure that your employees know their deadlines, right? We want to make sure that no one has a penalty when enrolling into Medicare because they delayed their enrollment for one reason or another. Obviously if they have coverage still, then they can delay, but we just want to make sure that they have credible information at their fingertips and that they do things in order and accordingly.
Excellent piece of advice. Know your deadlines, deadlines, deadlines,
Yes.
deadlines. So, this has been fantastic, Xavier. Thank you so much. You've really walked us through it, all the building blocks of Medicare 101 and where we can find trusted resources, and also knowing we have you as a resource. And so I want to thank everyone who was able to join. And as we mentioned at the top of the call, this has been recorded. We will be sharing out the slides. We will share out the recording of today's webinar call. And we thank you so much for joining. This officially marks the end of the webinar.